The Treatment Action Campaign has been involved in health activism for many years. It's a non-party affiliated and has launched its People's Health Manifesto, which includes a list of 25 demands. To talk more about this, I'm joined by Anele Yawa, who is the General Secretary of the TAC. Now, Anele, welcome to the show. You've been non-party affiliated all these years, and I'm picking up from where Stephen and Junior just left off. I mean, Abahlali Basamjondolo only last month decided to lend their vote to the EFF. Has the TAC ever had or considered even such a move?
Greetings to you, Vuyo, Stephen, and the viewers at home. As TAC, we are a human rights organization, and we respect the rights of the members of our organization to make a choice of who they want to vote for, and therefore it will be against the principles of TAC if you are to come and tell the members of TAC or the public who to vote for. There is a Bill of Rights in South Africa, and people have a freedom of choice, so people have to vote for the government or a party which they think that appeals to their needs. The answer is no.
Great, thank you. Your Health and Rights Manifesto that you've come up with, tell us how you've taken it through the various political parties and just how the response has been.
So over the past 10 years, TA, ahead of the general and local government elections, TAC will craft about a couple of questions and send those questions to political parties. And all the times, these questions is about asking political parties in the event they are voted into power, how are they planning to fix the broken public health care system of our country in line with the questions that we will pose. And on a number of occasions, political parties have responded very positive to our People's Health Manifesto. But as they say in English, Vuyo, it is easily said than done. What is responded to in writing and through the word of mouth is different to what is happening on the ground. And that on its own makes not only TAC members, but the majority of the public healthcare users not to be satisfied with the quality of healthcare services provided by our government within the public healthcare system.
And that's exactly the point, isn't it? I mean, because, you have had hearings, you've had public meetings where people have told you about long waiting lines, rude nursing staff, patient folders that go missing. Again, your organization, together with several other of your partner organizations, have been doing these surveys that show that people living with HIV, that show that sex workers and transgender people are still being badly treated at public facilities. In that 10 years on, with all the with that manifesto that you came up with, there's still not much change, it would seem.
Yes, it is like that. So that's why as TAC, after we commemorated our 25th anniversary on the 10th of December, we decided to come up with these 25 demands, as to say, these are the critical issues which still exist on the ground and which negatively affects the majority of the public healthcare users, not only people living with HIV or TB or the key population, but the general public who are the public healthcare users. So we agreed to say, if we are moving towards the process of the elections, it is upon our right to hold political parties accountable, but also to appeal to the public as well as the voters, as to say, before you vote, don't use your heart, use your brains. Here are the 25 key demands, and these are exactly the questions we must ask the political parties when they embark on door-to-doors, when they embark on public meetings, as to say, how are you planning to fix the broken public healthcare system in line with these 25 demands? As we know, to say, our People's Health Manifesto is not an event, Vuyo. It is an unfolding program of action, as to say, from the beginning of the new administration, which is going to be coming into power, I do not know when, but after the 29th of May, our program will be framed around these 25 demands. And we are clear as to say, in the next 5 years, we're not going to rest, and we will make sure that these 25 demands are met, and we're going to hold those elected into positions of power and in government accountable in making sure that what is on the 25 demands in our People's Health Manifesto is delivered to the people of our country.
Quick last question, particularly because it's relevant to the discussion Stephen and I are going to have with one of our guests. The ANC and the government would have us believe that the NHI does all that your 25-point manifesto actually demands and more. Do you agree?
I do not agree, Vuyo. One of the problems, quick. So we will remember that as South Africa, we are coming from an apartheid era where the healthcare system of our country was skewed to the whites, and we had Bantustan system. And then after 1994, we had to build a national healthcare system. But there are a couple of mistakes which happened during that process. One of those mistakes is around budget allocation. Me and you, we must ask ourselves, why all those people who are providing healthcare services within our public healthcare system are not accessing healthcare services within the public, but they prefer to go to private? It is because of government policies. Until such time, our government stops this government employees medical scheme money being given to the private, it must be invested to the public. Until such time, the MPs, the cabinet, MPLs, councillors, and everyone stop taking decisions for the public, yet when them and their families are sick and dying, they run to the private. If all of us can invest more resources, the doctors and the nurses and public servants, the MPs and the MPLs, all of us, we stop using the private, we take all those resources, we invest them in the public healthcare system. It therefore means all of us, we can see NHI being realized. Until such time, I queue in a same clinic with the MEC, with the MPL, with a doctor. It is only then that we can be able to fix the broken public healthcare system of our country. As long as the politicians takes decisions in parliament for the public, yet they know that when their families and themselves are sick and dying, they won't access those healthcare services. That means that we still have a long road to go. But lastly, the NHI, when it is implemented, the majority of the public is made to believe that immediately, like for instance, on the 15th, the president will be signing the NHI, and many people believe that on the 16th of May, we will be able to access, or the NHI will be implemented in all the clinics. It is not like that. There is an office which is called Office of the Health Standards Compliance, which is established according to Section 79 of National Health Act. Okay. That office is the one that is going to inspect and certify health establishments which will be ready to be beneficiaries on the NHI fund. And out of the 3,700 clinics, not all of them are yet ready to be able to implement the NHI in our country. So there is a long road that we still have to go to fix the broken public healthcare system in order for the NHI to be something which will be realized by all those who are citizens, those who work and live in South Africa.
Anele Yawa, thank you very much for the time. He's the General Secretary of the TAC.